start with, we will be doing active range of movement at the ankle. This will involve me giving the client an instruction on how to do the movement and them carrying it out by themselves. Throughout, I'll be checking for quality of the movement, any compensation, and making sure to ask for pain. I will always start with the non-injured side and then move to the injured side. So first, I'm instructing them to bring their toes towards their shins, and this will cause the tibialis anterior to contract, allowing for dorsiflexion. Then I'm asking them to point their toes towards the floor for plantar flexion. For this, we will have contraction of the gastrocnemius and the soleus. For this part of the assessment, I will be doing passive range of motion. So this will be myself as the practitioner taking the weight of the client, the muscles and the joint, and doing the movement for them, and ensuring that they are as relaxed as possible. So I could ask them to take a deep breath in just to make sure. So here I'm just starting with plantar flexion, making sure to support the ankle while I'm bringing the toes down towards the floor. And now just doing dorsiflexion by using my forearm to push the base of their foot towards their shins. I will be again asking for any pain and looking at their face to see any hesitation. For this part of the assessment, I'll be doing resisted range of movement. So the client will be working their way through the movement. However, I will be applying a force, and the client should match this force to bring their foot upwards. And this will then be graded on the Oxford scale, which goes from 0 to 5. So here I am just doing plantar flexion with my hands under while they're pushing down towards the floor, and then moving on to dorsiflexion. So starting them slightly in a plantar position and then asking them to bring their toes towards their shins. So now we are moving on to active inversion and eversion of the foot. So I'll be asking the client to do the movement. So I'm asking them to bring their big toes in towards each other for inversion, which will contract the tibialis posterior and tibialis anterior. And then for eversion, asking them to bring their big toes away from each other, which will contract the panniculus longus. And now we will be doing passive range of motion, where I will be doing the movement for the client. Again, throughout this, I'll be asking if they have any pain. So here, just doing eversion and then moving on to inversion. Also looking up at their face for any hesitation. So here I'm now doing restricted range of movement for inversion and eversion. So I will just be applying a force while the client is either pushing outwards for eversion or pushing inwards for inversion. And again, this will then be rated on the Oxford scale from 0 to 5. So here we are now doing a functional test. So for the ankle, I'm asking my client to do calf raises. So I'm just explaining how they will carry out the calf raise. I'm asking them to do 5, and I'll just be looking at that quality of the movement and seeing if there's any pain or fatigue that occurs.